It's great to be with you guys. And just to add a little bit to the funeral home issue, one of the things that we do to help facilitate once a funeral home has picked up a body is we have a dedicated operating room here in Salt Lake City at the office of the medical examiner in Taylorsville. So we will actually use that facility if at all possible so that we don't have, if we can help it, a body transported back to a hospital. So we've done some things to try to minimize that. But I'm going to talk a little bit about what tissue recovery looks like, some of the uses, a little bit of, Nicole covered a little bit of that. But these are the tissues that we currently recover at Donor Connect. We work with 6 different processors, and the processors are the tissue banks in the country that are all accredited by the American Association of Tissue Banks. And we choose processors pretty much based on the demand for that tissue that processor produces in our service area. And so there are lots of good tissue banks around the country that we don't send tissue to because we have a limited number of donors to send. And so I'm going to use some slides just sort of as a disclaimer about from MTF Biologics, which is the largest tissue bank that we work with. Let's talk about just a little bit about the rules that we fall under. We're regulated by the FDA. So tissue banking is completely different than organ donation. Organ donation is regulated by CMS, and we're regulated by the FDA just like blood banking is. So basically the same rules apply. If you can be a blood donor, chances are you can be a tissue donor. We also are a member of a voluntary organization, the American Association of Tissue Banks, as I mentioned. And again, the complete difference between organ and tissue. I've heard many times, you know, tissue donation is so unregulated, but organ donation is so overregulated. And I just think, oh my gosh, you don't even know the half of it. When you're regulated by the FDA, you know, they're the ones that show up with the badges and walk into your office at any time and say, you know, we're here for 2 weeks to help you and, you know, inspect your process. What do tissues do? And this is the thing that you don't see on the evening news, because when someone gets a life-saving, that heart transplant, that lung transplant, that's the news story. When someone gets skin for burns, or someone gets a heart valve, or someone gets an abdominal aorta, it doesn't really make the news. But those are life-saving gifts that provide people the chance to live on and live a healthier life. But this gives you an example of how tissue is used. A lot of the pediatric heart valves, more than 100 are used every year, just right up the street here at Primary Children's Medical Center. The important thing I like to bring up when I talk about tissue recovery is our tissue supply is safe. All of our donors are tested for infectious diseases. We do physical assessments. As Nicole mentioned, we do a very exhaustive, which is very difficult for families, the medical social screening, asking a lot of personal questions over the telephone to someone that you have never met before. And all of that is done to make sure that the tissue that we recover is safe and that we don't cause any harm or transmit any type of infectious diseases. And there are thousands of tissue transplants performed in Utah, southeastern Idaho. Regardless of the size of your hospital, almost any hospital can use tissue in some form. Not all hospitals do organ donation, but many hospitals use tissue. How is it used? For bone, which is provides the most grafts per donor. It's used in trauma, spine surgeries. I'm going to show you a video at the end. It can be used in oncology, limb salvage, and then we use skin, of course, for burn patients. Skin can also be used in different specialties, urology, neurology, and you can see the others listed here. The number of surgical procedures that tissue is used grows every year because surgeons find a new use for a tissue that wasn't being used for that last year. This is again from Musculoskeletal Transplant Foundation, or MTF Biologics. This in 2023, they placed just under 30 3,500 tissue grafts. This is just from one tissue bank in Utah. So there's a very high likelihood that people in this room have had a tissue transplant, or you know someone that's had a tissue transplant. I'm a donor family. I had a brother-in-law that was a donor, and then I received some donor bone in my jaw to help replace a tooth. But so many people are affected by tissue donation. We wish that all recipients would write letters and all donor families could get letters. There are important packets that are sent with the tissue that we hope that the hospitals in the operating room distribute to the recipients so that they know that there's that opportunity to write to their donor family. And so those are, people call them transplant cards, all sorts of different things in the operating room, but there is that ability for tissue recipients to write anonymously to their donor families. Those letters come to our family support, and then we distribute those to our donor families. There we go. So what does tissue recovery look like? Got a couple, you guys are medical professionals, so I trust you. I took out the really bad slides, okay, the really gross ones. This is what tissue looks like after it's been processed. So in the upper left corner, your left is a saphenous vein. We used to use those in cardiac surgery to restore blood flow, and we still use those from the person's own leg. We don't use those from a donor into another patient for coronary bypass. We now use it in peripheral vascular surgery to restore blood flow to a limb, and so that that person doesn't lose that leg due to peripheral vascular disease, diabetes, or other health issues. You can see the two heart valves, the aortic valve at the top and the pulmonary valve right here. Those are the valves that are used up at Primary Children's, or they can be used in other hospitals. And then on the bottom there is the femoral vein, and that is used for patients who need a fistula for dialysis. That can be actually placed right into an infected site. Normally, working in the operating room, you use a man-made material because you have the product on the shelf, the perfect size, and it's ready to go. This is for when that patient comes in with that infected Gore-Tex graft or whatever the surgeon may have used. This can be used to continue to give that patient dialysis, which is kind of important to keep their kidney function working. The abdominal aorta is the same type of graft. It can be placed into an actively infected site and literally save that patient's life. The company that processes these, the one company that we work with two companies. One is called CryoLife. They have since changed their name to Artivion. And then we also work with another processor called LifeNet that processes these valves, and both of them distribute tissue here in Utah. As I mentioned, bone donation comes in all shapes and sizes, and I'm just going to show just an example of how bone can look and be used. When I worked in the operating room, you see the little jar that spilled over. What do those look like? Croutons. That's what we used to nickname them in the operating room. The surgeon would go, give me a size X millimeter croutons. And so we would give these different tissues names. Critical tissues, though, in helping heal our patients who are undergoing all different types of surgeries. I'm going to show you one that was done on a little girl. This was up at Shriners Hospital, just up the road from us. You can see on the upper picture there, she's got a large tumor in her tibia. The option for her is amputation. Debulk the tumor, amputate, hopefully save the knee, and then we can fit her for a prosthetic. We've got some surgeons in Utah that don't like that opportunity or that option for the family, and they will sometimes opt for, if it's possibility, of using actual donor bone to restore the diseased or cancerous bone to restore that child's limb. And there's an example of you can see the tibia that's been placed with the plate, and so this is all donor bone that's been sized and prepared by MTF so that it can be used in this type of surgical procedure. Now, do all of these work every time? Sometimes they they fail. The difference between tissue donation and organ donation is you don't go on anti-rejection medication when you're a tissue recipient, like you do if you receive a liver or heart transplant. You're not required to take prednisone or any type of medication. And so in most cases, the patient's bone will begin to regenerate and grow into the donor bone, sort of like a lattice in your garden, where that vine starts to incorporate. So you thought you had a bad day today. We will do some specialty grafts. Sometimes we're called on because there's been a unique injury. We've been asked to recover bones from the hands, bones from the wrists because of injuries to paramedics, severe burns, things like that from our processor. And then we can do the special recovery. The processor will prepare that bone, and then that tissue can go into that person to save that hand or that digit to give that person a better outcome at life. This is a young boy that just had some arm pain in his upper shoulder and finally complained to his mother. They go in and they think, oh, you know, he pulled or tore a muscle. And it turns out he has an aggressive osteosarcoma in his humeral head. And so the option was, we need to amputate. Family went to another orthopedic surgeon and said, you know what, I've had some success being able to use donor bone with a prosthetic. So he had some time. They were able to make this work. And there he is with his mom. That's actually at MTF Biologics, which are back in New Jersey. But you can see the donor bone that's here, and then you can see the long stem from the shoulder prosthetic that was placed into this young boy. Some of the cool stuff that's happening in tissue donation right now are the introduction of biologics. And what that means is we now have tissue forms that we place into the body, and when we connect them to a blood supply, they actually grow bone. So they're osteogenic, osteoconductive, and osteoinductive. This one is called Trinity Elite. There are many different versions of this, but this has been some of the great advances in tissue recovery. So if someone has a fracture that does not grow back and they're having a non-union, this is what is used. We used to have a physician's assistant that worked for us on our recovery team at McKay Hospital, and he told me that they just used this stuff like candy. It was nonstop. And very great outcomes for these patients. And this comes from our young donors. From our donors, I still consider them young, all the way up to age 60. So, I'm no longer a young donor. Sorry, yeah. Here's an example of some other uses of tissue. The diagram in the center is, we're just ending ski season in Utah, but we get a lot of torn ACLs. And so the option is take half of a patellar tendon from yourself, and then you can sort of weaken that leg, or you can take part of the hamstring and fold it back and create an autograft, or you can use donor tendon. And so depending on your particular need and your surgeon's preference, that's what is going to be decided. There's an example of what a patellar or a bone tendon bone graft looks like. You can see they've done some amazing things with tissue forms. There's actually a screw not made out of stainless steel or titanium, but made out of bone. So we don't have to worry about it backing out. Other different forms, putties, pace. This tissue right here, here's an Achilles tendon that could be used in an ACL. There's the heel bone with the tendon attached. One of the new grafts that we've been recovering for the last couple of years is the costal cartilage. And there's a problem that you've probably heard of where children are born without ears. It's called microtia. And the way to treat that was to take a second operative site, remove cartilage from the child, and then use that cartilage to create an ear for that child because they were born without an ear. Now we're using donor tissue, so we avoid that second operative site, the pain, risk of infection, morbidity that could come from that. So other advances, and it's being used in reconstructive surgery, not somebody who's going in to get their nose adjusted because they're a movie star, but these are people that maybe have gone through a traumatic accident and have some serious trauma or some cancer, basal cell cancer or a squamous cell that has eaten away at the cartilage of their nose, and this tissue will be used to reconstruct that. One of the greatest advances we've seen is the use of dermal tissue. Up at the Huntsman Center, the Cancer Center, this tissue is used every day on women who undergo mastectomy for breast cancer, and then they undergo the reconstruction during the same surgical procedure. Back when I worked in the operating room, which was eons ago, you'd fit the woman for an expander and they would come back for 2 or 3 additional surgeries. It was painful and the outcome was not that great. And now it's all done in one surgical procedure. It's very amazing. This is what skin looks like once we've taken it off the body. They're taking the fat layer off the skin. They're using a very sharp blade, and they want the grafts to be about 20 to 25 centimeters in width and about the same in length. And the old way of doing the reconstruction, putting in the prosthetic, was they went subpectoral. Now they place the prosthetic on top of the pectoralis major. And the outcomes, this is a picture of a surgical procedure where they're using, you can see this is the dermal skin that's been turned into this graft. And you can see the prosthetic being placed in. And then you can see the graft that's supporting. There's no muscle because everything has been removed because of the cancer. And so this is what's going to support that prosthetic and give that patient that natural appearance. That's what it looks like. It's completely wrapped around the prosthetics. And I'm sure today, if today is a normal day at the Huntsman Center, they probably used 5, 6, or 7 of these grafts. And there's a picture of what it looks like. This is the subpectoral. This is the way we used to do it, and now surgeons are moving to this way, which is giving a better outcome. They continue to learn as they use these human tissue forms. This is called an acellular dermal matrix, an ADM. And that's a picture of it. This is what we used to do back when I worked in the operating room eons ago. Now we don't like to use Marlex mesh. We like to use this human tissue because it doesn't scar down. It doesn't get infected. We have much better outcomes. Pain and morbidity, risk of infection are so much better for our patients. So did it save this patient's life, curing this ventral or abdominal hernia? No, but it sure made the outcome better. And their OR time was decreased, so their cost is down. Here's another way these ADMs can be used. You can see a rotator cuff here that's been torn, and then the ADM actually has healing potential when added to the sutures to help your body heal faster. Here's an example of a diabetic foot ulcer with using the same type of material, and this is where they're seeing some great advances in wound care. Again, this is coming from the dermis. We always knew the epidermis saves the lives of our burn patients, but now dermis is helping us treat patients with these severe, terrible diabetic wounds. Thank you, and especially thank you to our donor families that make this possible. There's a picture of our Donate Life monument down here on Library Square.